Okay. Well, hello everyone. Welcome to the Healthy Joints, Healthy Lifestyle Show. And today we are going to answer the question does gluten affect my pain? And what we should do about it. So my name is Dr. Arinola Dada. Welcome. And the Healthy Joints, Healthy Lifestyle Show is basically where we talk about the immune system, we talk about healthy joints, healthy life, and we talk about if you have an autoimmune disease, how do we get that corrected? And if you're having joint pain, how do we become joint pain free? So you know who I have today is not only an amazing physician, but a really good friend of mine. So Dr. Sarah Merritt is phenomenal. So she went to med school at University of Alabama, did her residency in North Carolina. She went to Johns Hopkins for fellowship. And so in her clinical practice, right, she not only does the needle-based procedures like, the epidurals, radiofrequency, ultrasound injections, but she's actually one of a handful of physicians that are board certified in 3 subspecialties. So anesthesiology, pain medicine, and addiction medicine. So Dr. Merritt has a private practice at Lifestream Health Center. And in her spare time, she and I actually worked out together once, right? She's into family, bicycling, running, and yoga. So Dr. Merritt, welcome to the show.
Thank you. Thank you so much for having me. And I am delighted to be here and to hang out with you virtually.
Okay, perfect. So, the talk today, it's really going to be questions that I think we've heard over and over from our patients about gluten and pain. So I'm going to start a little bit about Dr. Merritt. Can you tell us a little bit more about why you do what you do? And then we'll kind of go into some questions that I've been thinking about, and I would really love your input. So I guess the first thing is just if you could tell me, why do you do what you do?
Yeah, I got interested in pain medicine really because if you help somebody who has significant chronic pain, you will find that you've really made an impact in what the patient feels like is their biggest problem. And so if we look at, heart disease and hypertension, these things may be killers, but really, like, where do we feel the impact in our daily lives? It's often really with pain. And so my specialty interfaces a lot with yours in rheumatology, and we have maybe kind of a different set of tools and approach a lot of the same problems, and with a similar but slightly different lens. And so for me, being a pain doctor really became super interesting as I was interested in the nervous system and, how we experience, pain and other sensations too. And then just feeling like it was so impactful when I'm able to help a patient with significant chronic pain.
Yes, and you're right. We have such an interface, right?
Yeah.
And we both kind of, are focused on exactly the impact. How do we get our patients to minimize the pain so that they can have a good quality of life, right? So let's dive into kind of our, the questions that patients have asked, right? One question is, I think a patient had asked, hey, they've heard that gluten can make pain worse. Is it true? Should they try going gluten-free? What do you think?
Yeah, I think it can be a really worthwhile thing to try. And I would just share, in my practice, on the one hand, certainly we do things like manage medications and we offer injections and things like that. But I also work with a lot of patients that might not be might be wanting to take as little medication as possible, or might not be ready for an injection. And it's a legitimate question, like, well, what else can I do? Is this all you have to offer me, doc? Is like, a medication and or, an injection. And so I think it's really important to have some real answers for patients about things that they might be able to try. Are there things that you could do for lifestyle? Is there lifestyle management of painful conditions? And I would say, that not every patient probably has pain that may change with a gluten-free or low gluten diet, but I think it can be worthwhile, and that's really where I've gotten to myself. And I would share that I'm not gluten-free, but I'm pretty low gluten in terms of my consumption at this point. And I've really find that I feel better most all the time as a result of
Yeah.
kind of limiting
Yeah.
this intake.
Yeah, I totally agree. I think I've had patients, we've had patients that we identified actually had celiac disease, which is they actually had a serious gluten sensitivity issue,
Yes.
right? And they come in, they stop the gluten and they feel better. And that's a long road and a much easier path, I would say, than the path of where we're trying to control the symptoms with medication. Meanwhile, the thing is really more like an allergy, right? And there's also patients who don't even meet the criteria, just like you said. They don't really meet criteria for having like celiac disease, the full-blown condition, but they're sensitive, right? So I also, just like you, Dr. Merritt, I really encourage people, look, why don't we try it? And we'll try it for some months and see. And if you start to feel better, then I think that's a path worth exploring, because some of it is just allowing your body to kind of heal itself and trying to do things naturally, right? So
yeah, I think there's so much interest in that, and it feels like a big change or a big adjustment, I think, to consider eliminating gluten, and particularly when it's really kind of voluntary, right? I think that those people with celiac, who, the process of getting diagnosed with that is, certain GI upset usually related to certain foods. There's some testing that gets done at the GI doctor. But and so that's one path, but then there's also non-celiac gluten sensitivity, which is just what we were talking about, being a person who appears to have some side effects related to gluten intake. And really the way to find out if you experience that is by eliminating it, or sometimes people will talk about an elimination diet, where you might eliminate it for at least 2 weeks would be the bare bones minimum amount of time you would need to eliminate to determine if it made a difference. And then to your point, Dr. Dada, I agree, really probably going a month or two would be a better trial.
But at least you start, right? So, one of the questions, I would think that it's a little bit, it's a little bit hard, is it, right, to really be gluten-free and try to eat out, for example, right? Because I'm sure there's so much cross contamination in restaurants. I'm just kind of just thinking that through. That in that time when you're really trying to be very strict, you may have to probably eat at home, right? Probably eat at home and minimize cross contamination, right?
Yeah, I think there will be. So I think there are a couple ways to think about it. One is, maybe emphasizing whole foods, plant-based kind of dietary choices, which might mean a salad with vegetables or fruit. Those things presumably would be less likely to contain gluten. But what about a salad dressing? It's possible that a dressing might be made with that. Now, if you have celiac disease, then those micro amounts of gluten are enough to be really triggering and unpleasant. If you don't have celiac disease, but you might just have pain that's inflamed by gluten, I would say, in my experience of working with patients, those micro amounts might be okay. And you might, I think this is going to be a person to person difference, but that you might be able to, get by with something
without being kind of in a bubble, right? So that you can tell. That's good to know, right? Because I think people get a little bit, anxious. Is that, how much gluten-free is really gluten-free if they don't have celiac disease. So it sounds like, there may be some flexibility where you can really, the best of your ability, minimize, but if there is some minimal cross-contamination, probably doesn't impact the overall benefit that you would get from consciously.
And maybe the way to explore that too would be, an elimination diet where you had some time that you were very strict, and maybe 2 weeks of the challenging, extremely strict, no micro amounts, versus kind of the gluten-free but not obsessing over the micro amounts. And again, if you're not if your diagnosis is not celiac disease, if you're really just checking to see if there's a gluten component to some of your pain and inflammation, you may be able to tolerate, the micro amounts.
Yeah. So it sounds like more flexibility. If you don't really have full-blown celiac disease, we have more flexibility.
Yes, and
So
that's
yeah, okay. So and that's helpful, Dr. Merritt. So next thing, Sarah, is, can you explain how cutting down gluten from my diet may help with my chronic pain?
Yeah. So there are a couple things to think about. There are a couple ways that it could help pain. One is healing the gut a bit. That there is a something called the gut-brain connection, and our gut, or our GI system. We eat food, it goes into our stomach, it goes through our intestines, it's bled out when we have a bowel movement. That whole process, it's traveling through, what we call the gut. And so in certain parts of the intestines, there are little villi, these little fingers in these areas that help with food digestion. And they're for people who have celiac for sure, and also some with non-celiac gluten sensitivity. The just the anatomy in this area, and,
Yes.
and the microanatomy is compromised.
Yes.
Sometimes by the digestion of gluten.
Yeah.
So gluten's a protein,
Yeah.
and it's just challenging to digest, and it's not for some people, not for everybody.
Yeah.
It messes with the integrity of this area.
Yeah.
So that's one of the ways that less gluten may help your pain, is it could help just your GI system in general. And a healthier GI actually is correlated with a healthier brain. And
Yes.
really all of our pain signals, even say they're from our joints, maybe we have a knee with osteoarthritis. Well, those pain signals are also involve the brain, right? That all pain is actually felt in the brain. And it may feel like, well, this is just my knee, actually. But it's a complex relationship, because it's all processed and felt, and your brain experiences it, or you experience it as a person through the use of your brain. And so, again, I think that healthier gut-brain connection actually has been shown to help pain processing pathways. Imagine those things like exist kind of on a spectrum, and your pain processing volume can be turned up so that like every signal is experienced really dramatically, or kind of like turned down so signals are maybe not so dramatically
impacted.
It's shifting that volume control in the brain, and we do have evidence that gut inflammation can help with that.
So it sounds like, if we are able to, so we talked about, Dr. Merritt talked about kind of the villi, and the villi basically just allows you to have more surface area for absorption, right? And so if that's damaged from a gluten sensitivity, from that gluten, then, and that protein damages the intestinal wall, minimizes your absorption. And if you can keep away from the gluten that aggravates, then the gut can heal. Right, it's kind of what I'm hearing. That, so just by minimizing your exposure and heal, you now have that surface area, and your absorption is better, and you're getting your nutrients better. And then remembering that your brain is a nerve, and you feel pain through nerves. Is kind of how I explain it to my patients. So the pain is in the knee, but yes, your nerve impulse is sent to your brain, and your brain says, well, that's pain. That's not a massage. And that's how you interpret it and experience it. So that's so helpful, actually, because that's a question I actually always wanted to know too, is do we have some real scientific backing towards, explaining that whole, gut-brain association? Okay.
Yeah. And I think that there's also secondarily some data about so diabetes and insulin resistance, right? So we know that there are many people in the United States with diabetes. This is a type 2 diabetes in particular comes about as people become resistant to insulin in their bodies. And so there is data that suggests that chronic pain is associated with insulin resistance. And so the first part of not even, you don't even have to have type 2 diabetes to have insulin resistance. You can, that's that metabolic syndrome when you just start to have a little bit of insulin resistance. And so anywhere in the spectrum of having a bit of insulin resistance, which is associated with higher carbohydrate intake, which is associated with gluten, right?
Exactly.
If we're staying away from gluten, and your question was, how could that help my chronic pain? Well, we're just going to kind of like try to stay out of this zone of like insulin resistance and pre-diabetes and
diabetes. Yes. Yeah.
If you're already diabetic, then certainly reducing carbohydrates and lowering gluten can be one way to do that.
Yeah. And that makes a big difference. Again, kind of minimizing reliance on some medications, right?
Yeah.
Okay, good. And so another thought is, what are some gluten kind of foods? And you touched on that a little bit when you mentioned salads, though. What are some gluten-free foods and meals that you feel can really help to reduce the inflammation and pain? So just for people that want some practical ideas.
Yes. I think it's just shifting the framework a little bit of how you think about food. And I can just share for myself, there might have been a time that I would eat a granola bar or energy bar in the morning that might or might not have gluten. At this point, my diet is a little more toward intermittent fasting in the morning, where I try to not have an intake of food until at least 10 or 11 a.m. Okay, so that's not going to work for everybody because it depends on your metabolic situation. That intermittent fasting may not be a good idea. And then I think salads, midday. Sandwiches are delicious, but maybe veering away from something that is bread-based and more toward an emphasis on fruits, vegetables, possibly, meat if you eat meat or eggs, those types of things. And really, those are like foods that are naturally gluten-free. The other thing I would say is, a lot of processed foods contain gluten. And so to the extent of, what's a healthy way to eat? Well, minimizing processed foods and eating more of a whole foods, plant-heavy type of diet. That's going to already move you away from higher gluten containing and processed foods. And that maybe, like, I think also just moving away from processed foods, if we're talking about dietary approaches to pain. I think reducing gluten is one of them, but another valid one is just reducing processed foods.
So I tell my parents, coming out of a bag and a box, you probably want to try to avoid them, right? I mean, they're quick. And I have also kind of done the energy bar thing because I'm hungry and I didn't plan. Oh, yeah. So planning your meals is important, right? And I'm working on that myself. But, when you even talked about a sandwich, I remember seeing, I haven't made it yet, but there's a spinach wrap you can make, right? So you can still get that feeling of having stuff, in a sandwich kind of thing, but you can make a spinach wrap at home. I saw it on a channel, so I'll make it. Maybe I'll try something this week.
Oh, yeah.
Yeah, so I think planning your meals is probably the most important thing. Otherwise, you just kind of reach for things, right? So I think if you plan your meals, then when you're hungry, you're not just reacting, right? And I think that would be kind of the way to then when you've planned for your salad, you've planned to avoid bread, you basically have a plan for your meals during the day, and then you can reach for things that are healthful and minimize your gluten exposure, other than being starving and then now you're in panic. And then you're forced to eat things that are not kind of aligned or not aligned with your intention.
Yeah. Okay. I think thinking also of just food as fuel is a really valuable insight, that food is not a treat. It's not a reward. And we treat it that way so often. And it can be, but that's really not like what our daily relationship with food needs to be.
That's yes, if I think about food as well, not as pleasure, they say that the oral phase is still active in a lot of us.
Right,
Just
right.
oral pleasure, right? So yeah, I think that if we think about food as food, like especially if we think about it and plan for it,
Mhm.
but yeah, totally agree. And I'm honestly going to say I'm still working on that,
Oh yeah. It's a
rather than food
daily.
is pleasure.
Yeah. Well, and at this point, when you asked about meal ideas and practical ideas,
Yeah.
where I've gotten to also, I would say is a little meal prep on Sunday for the week. There's a particular kale salad that I make that I really enjoy, and a real treat for me is to like steam some shrimp and have a couple of days worth of steamed shrimp to go on top of it. And I just really enjoy that. And so that's where, and we get to that, food as enjoyment, not just fuel,
Yes.
but it's like a nice marriage, figure out
Yeah.
what is that meal for you, right?
Yeah.
That meal that is checks all the boxes of the, healthy, consistent with the way you want to eat, but you also find it delicious. That's a good meal to put on repeat.
Yeah, definitely. And I'm going to steal your idea for Sunday prep because, yeah, on Monday, I do not have time for that because I leave my house early. But yes, but yeah, I think I'm going to steal your Sunday prep idea.
Mhm.
Okay, so I think one question we have is, patients, and this is kind of, I think, is in your world sometimes and a lot in my world too, is people with fibromyalgia, kind of also asking that question, should they consider, because I know they're in your world too, should they consider a gluten-free diet? Would you recommend that, or what do you think?
I think it would be worth trying, and for a couple reasons. One is just, doing anything with intention and prioritizing, yourself. I think there is a piece of like, self-care to care of fibromyalgia and painful conditions. And it's not just like the fun Calgon bubble bath version of self-care, but really, being nice to your body and, giving it the exercise and the
Yeah,
sleep and the
yeah,
nutrition that it
yeah,
needs.
yeah,
Um, I think it would be very worth trying.
yeah.
We also know that fibromyalgia really benefits from, it doesn't benefit that much from, say, opioid medications. They're not,
No, it
like the
does
best
not.
therapy for
Yeah,
it.
yeah.
Um, Light aerobic exercise,
Yes,
and just um,
yeah,
anything that's going to kind of improve your ability to like be more
yes,
active, including a
yeah,
healthy diet. Um,
yes,
there is some particular data in terms of that insulin resistance piece for
yes,
being a trigger or a factor for some people with
yes.
fibromyalgia. And so I think back to the gluten sensitivity question, or would trying a gluten-free diet be helpful? I think that it might be, because if there's at all a component of that insulin resistance piece for a
Yeah,
person with fibromyalgia, they might have particularly good pain benefits.
yeah, 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 totally agree. With the fibromyalgia, it's multifactorial, and totally agree. We don't use opioids because I've had patients that seen other doctors with opioids with fibromyalgia on opioids, and their pain is still, 12 out of 10. So it
Yeah.
seems like that opioid is really just
Yeah.
increasing their
Is
risk of
that
side
really
effects, but without
attenuating?
providing
Yeah.
any benefit. So,
Yeah.
and yes, and with people with fibromyalgia, it's so multifactorial and so individualized their response that yes, I definitely agree with Dr. Merritt, is that we do encourage trying a gluten-free diet and seeing, and all of it is exactly the self-care. And it's so interesting, we think about self-care, we think about the massages and the bubble bath, like you said,
Right.
but the exercise and being thoughtful and making sure that your behavior is aligning with the way you want your body treated, right?
Yeah.
Yeah, because you have complete control over that. Are there any tests, would you say, that people should undergo to see if gluten is causing their pain?
I haven't done any of this type of testing. I think there are some, there are some people that do some dietary testing or may look for, there may be some things in the
Like
functional medicine
antibodies,
world,
yeah.
but these are not things that I'm really doing myself,
Yeah,
so I can't talk too much about it. But
yeah,
I do think that the elimination diet, I think we could
yeah,
think of
is
as
a
a
good
test.
test. Yeah.
And then if you have, if you maybe did even a little bit of an elimination diet and found
Yeah,
differences in your GI
yeah,
habits, it
yeah,
might be a signal that you should get tested for celiac disease,
yeah,
because it may
yeah.
be that you know, just thought, oh, my bowels are always like this, but then you
Yes.
eliminate gluten and things
And
change.
then, yes.
And traditionally, I think we've talked about celiac disease as being, just a tendency toward, looser bowels. But, as I understand it, it can actually be either way.
Yeah, it
So
could be. Yeah,
IBS,
you can get constipation issues. Yeah,
that's right.
exactly.
That's right.
Yeah, it
So
could
if
have
you
been
found
IBS for years.
yeah,
Mm.
that's right. And so I think that it is something that can be kind of subclinical. People can be kind of living with it and not even hardly realizing. But then they may have a big change in how they feel. Hopefully, if you have that diagnosis and we're eliminating gluten.
Yeah, yeah, I totally agree. There are some times when we do the blood tests,
Mhm.
and you kind of need about 3 of those antibodies to actually make a diagnosis.
Right.
But you have people that sometimes just have one. And I'm like, well, what is this antibody doing here? You may just have a gluten sensitivity. And then those are the people that we want to start trying elimination diets for. Because no, you don't meet criteria, but hey, why is this antibody, this one and lone ranger antibody here? So in those people, we definitely encourage that minimum of 2 weeks, like Dr. Merritt said. But I typically find, it's a 2 or 3 month, commitment to really see if eliminating gluten is really going to make a big difference in your life. Wow. So Dr. Merritt, thank you so much for your time with us. Can you give us an example of one of your patients that really stands out to you as having had a really good outcome after working with you? Because, a lot of patients, they kind of identify with kind of other stories of other patients. So is there anyone that comes to mind as someone who's really had a good outcome, or really after working with you has had really a dramatic change in their quality of life?
Yeah, that's great. Thank you. Yeah, I would share that I can think of a fibromyalgia patient that we've worked with who had gotten to a point where she was really having trouble doing really basic things, and had a number of lifestyle related factors that were, I think, impacting it. And some of it was stress and life events. Some of it was a small amount of weight gain, not even a huge amount, like maybe 10 or 15, 20 pounds. And then her activity level had decreased, and she had really gotten to a place that she was, just not able to do much and pretty miserable. And I saw her lately, and she's just doing so well. And really what's made a big difference was finding some medications that were effective for her, helping her to regulate her sleep, helping her to recognize, I think, the contribution of some of the family stresses to this. And yeah, I think the sleep honestly has been kind of the number one thing for her. She is taking a medication that's helping with her sleep, and she really just seems like she's doing a lot better. And in fact, when I saw her this past week, she said she's hoping to get her daughter to come see me, who's struggling with some similar things.
Wow, that's amazing. Yeah, it's always so rewarding when our patients do so well. And she's done so well that she's bringing her daughter along to say, hey, I want to, there is hope and we can actually do better. And yeah, so girl, congratulations to your patients. So excellent.
Thank you. Yeah, it's a good feeling, like, again, to help.
It is, and that's why we do medicine, right? It's those times when patients just, their lives have changed dramatically, and then we're like, this is why, it makes you feel really warm and fuzzy and happy that, we're making an impact and a change in people's lives. So on that note, Dr. Merritt, how can people find you to work with you?
Please, yeah, we are in Bowie, Maryland. My practice is called Lifestream Health. We are working to make pain management more patient-centered, caring, and accessible and patient-centric. We would love to come see you. Our website is lifestreamhealth.com.
Okay, perfect. We're going to put how to find Dr. Merritt, and also Dr. Merritt has a show. We'll also kind of link that in the comments. And so my name again for you, if you don't know who I am, is Dr. Arinola Dada. If you're in the greater Seattle area, look us up at overlakearthritis.com. If you think this video has been helpful, like it, share it, follow us on our YouTube channel, Healthy Joints, Healthy Lifestyle. Thank you so much, Dr. Merritt, for coming. And thank you, everybody, for listening.
Thank you.
Okay. Happy holidays.
Happy holidays.